Thank you to Catherine Proudfoot and the others at the Welfare Center for inviting me to do this talk. I'm pleased to speak to you today on a very tough subject: how do veterinarians navigate the complexities of health, welfare, and owner attachment in the context of international challenges for dog breeding. I'm Brenda Bonnett, and I'm Veterinary Science Officer at the International Partnership for Dogs, and we're online at dogwellnet.com, and the talk will be posted under blogs, Brenda's blogs, and you'll be able to get the PDF and study the slides that I go over very quickly. As a background, the health and welfare of dogs with extreme conformation, especially brachycephalics, continues to be a hot topic internationally, especially in Europe, but really everywhere. And many of the issues apply to dog breeding in general. It's ranged from conversation, controversy, to conflict. Some pretty ugly conflicts, actually, litigation and legislation, concern, outrage, and anger as these topics are discussed and events have transpired. Professional organizations like vet organizations and international vet organizations have come out with position papers and statements, sometimes supportive, sometimes angry, often sort of boilerplate, very big picture, and they don't always help the individual veterinarians who are on the front lines, caught between massively increased numbers of dogs, extreme owner attachment, and practical, moral, and ethical issues. And I'll talk a bit more about petitions in a while, but petitions against breeding and cries for more responsibility by dog breeders or by owners are important, but they do not relieve veterinarians of their responsibilities. So this talk is going to focus on veterinarians. And discussions have expanded to include many broader issues of dog breeding and breeders. And all of this, the veterinary aspect as well, is aggravated by pandemic problems. I mean, what isn't? So to quickly outline, the goals for today are to cover the context of recent international and national developments, looking at eventually what steps can individual veterinarians take for their own well-being, as well as the well-being of clients and dogs, and then what should veterinary organizations do. And just as an aside, the International Partnership for Dogs has been involved with these issues for years, providing evidence-based and multi-stakeholder resources. And there's many resources on dogwellnet.com, and I'll provide another list at the end of the talk. As an outline, we'll discuss the array of stakeholders involved in these issues, review definitions of health and welfare and human-dog interactions in the context of this problem, and briefly review the history of veterinary involvement from the late 1800s and early 1900s up through the 1960s, early 2000s, and now. This outlines all the stakeholders that have an influence on global dog health and welfare, and separated a little bit into the supply and demand side. So the public and individual consumers are, of course, the driving feature on the demand side, and kennel breed clubs and other breeders and sourcers of dogs on the supply side. Vets, welfare groups, pet industry, legislators, all involved, all have to be part of solutions. There's lots of information on international actions on dog wellness, but I'll just briefly go through a couple. Over the last couple of years, the Netherlands has brought in new legislation to support enforcement of existing legislation. They're calling for measurement of the craniofacial ratio in dogs and refused breeding of dogs with shorter muzzles. It's not going that well or that smoothly, and veterinarians are caught in the middle of that. There's been legal action in Norway where a welfare group sued breeders, breed clubs, and the Kennel Club for not following the law, and that has been decided, but the possible wider implications are very unclear. Many countries, Sweden, Ireland, and others, have legislation in place or coming along soon with variable enforcement about impacts of breeding on offspring, and some countries are limiting appearance at dog shows by compromised breeds. And then we have petitions from veterinarians in various countries looking to spur on more work and attention to health in brachycephalics. FACABA has come out with a video of veterinarians begging people not to buy these dogs, and several petitions are in the works internationally actually calling for breed bans. Not as much in US and Canada, but it's coming. If we bring the legislation and legislative legal aspects down to, in a nutshell, many laws have been written, few welfare laws are well enforced, and that becomes a problem. Sometimes the language is essentially unenforceable, sometimes it's a political statement. But I want to mention about the aspects that have looked at the influence on the progeny. So in Norway, they have a law that requires all animals be bred with good function and health, and prohibits any breeding that alters or perpetuates hereditary traits that adversely affect the progeny, the animals, physical and mental functions, or reduces their ability to engage in natural behavior, or in some way provokes general ethical reactions. In Queensland, Australia, their welfare standards include a statement that a dog with an exhibited deleterious heritable condition that has the potential to adversely impact the welfare of the progeny must not be used for breeding. Similar statements or laws are in the law of many countries. Again, enforcement is a problem or is not always happening. So when I've worked on this, I've tried to take and reflect on the language we use with animal welfare and relate that to some of the legislative actions that are out there. So I'm sure everybody on this call is aware of the 5 freedoms, the gold standard for animal welfare, originally done for individual animals to check out their current welfare situation: freedom from hunger and thirst, freedom from discomfort, freedom from pain, injury, and disease, freedom to express normal behavior, freedom from fear and distress. So if we take that and say, what about heritable conditions for the current dog, but also for the offspring that would come from a breeding animal or a breeding pair of animals, we can say these are the progeny likely to be able to reliably achieve, should the individual dog with their characteristics and their progeny reliably achieve the 5 freedoms? And what are some of the conditions that can be passed on to the offspring that should be considered? I won't go into total detail on this slide, but I hope you download the talk and read it and think about it. This looking at heritable conditions relative to the 5 freedoms, of course, breathing difficulties, locomotor difficulties, skin problems can cause discomfort, pain, injury, and disease, not looking at acute injuries, but chronic bad spines, bad hip dysplasia, etc., are passed on and influence pain, injury, and disease. Normal behavior we probably don't focus on enough, but there's many French bulldogs out there with very short spines and hemivertebrae and missing vertebrae, and they can't bend in half and they can't clean their hind end on their own. And that's pretty normal behavior for a dog. And also the breeds that can't breed and whelp on their own, that's also not being able to perform normal behaviors. And the box on the right side relates to conformation and other attributes, traits of the dog that can be expected to be passed on if selected for by the breeder, or if you have 2 dogs with short skulls, you'll get puppies with short skulls. And that goes for skin folds and basic body conformation, vertebral abnormalities, and inability to reproduce. So that's how I put these things together in the language of the 5 freedoms compared to the language of these legislations. And you can certainly see the case can be made that dogs are being bred with a high probability of producing problems in the offspring. So talking about changes over time, and not worrying about the 10,000 years from wolf to today. These are 2 skulls of British bulldogs from 1870 and 2010, so 140 years, and marked changes. And I think we would all agree that the skull on the right, which represents the desired type for bulldogs nowadays, would be passed on to the offspring and would almost certainly be associated with various health challenges. We can look on the inside with CT scans, and on the top is a dolichocephalic breed, and on the bottom is a brachycephalic breed. And in the brachycephalic, the turbinates are reduced and messed up, and the sinuses are smaller, and the palate is longer, and the tongue is bigger. And again, all those characteristics of that internal and external skull are likely to be passed on in breeding. In fact, it's selected for. That conformation is being selected for in breeding. Now, these are pictures that I hope you would never post on your clinic website, because they are typical of funny but not at all funny pictures of compromised breeds. Why do French bulldogs sit in these funny ha-ha positions? Hemivertebrae this is a slide from Professor Moses in Australia, and he says 80% of French bulldogs have some degree of hemivertebrae or missing vertebrae. Danica Banish at Davis estimates it to be 95%. Related, I think, both to genetic factors and to breeding dogs for shorter backs because of a specific type that's wanted. And similarly, skin folds, corneal ulcers are a function of the conformational anatomy of the head and can be passed on to offspring. So how did we get to this point of having these desirable pets with all these undesirable characteristics? In the early 1900s and even the late 1800s, people were putting up complaints for the changes to the British Bulldog. In the 1960s, veterinarians started to get involved in that research on BOS and respiratory problems, and brachycephalics started in the late 1950s. So we started to know it was a real problem, but nothing much was done on it. And you can read about that in our chapter I'll tell you about later on international aspects. But veterinarians looking at extreme breeding were focusing on hip dysplasia, which was common in the most popular breeds at that time, Labradors and German Shepherds. And although they realized BOS and brachycephaly was a problem, there were so few of them, it didn't sort of warrant their full attention. Flash forward to the 2000s, increasing recognition of problems in some pedigree dogs, especially in brachycephalics. Lots of educational efforts from RSPCAs and different groups, educating the public on the problems with brachycephalic dogs, the problems with BOS and other issues in these dogs. And that led to, wait for it, a massive increase in popularity of French bulldogs, pugs, and others. Not really sure why that happened, but we can certainly say that these major efforts to educate people against them did not work well, did not have the desired consequences. And how did this happen that we knew brachycephaly was a problem in the 60s and it only became this massive problem in the 2000s? Maybe we've been surprised by the sheer force of popularity of dogs with short muzzles. We like to blame that on celebrities and the media, but research has shown, and I'm sure Rowena Packer will cover this in her talk that is a later webinar. It's mainly a desire of people, something about the appearance of the dog that appeals to them. And even though they know it will be expensive and the problem, they just really want them. And sometimes they think it's great because they don't need exercise, which almost surely relates to their lack of ability to take much exercise. But anyway, we can complain about owners who just don't get it, and we can't get through to them, and we can't educate them. But what about the veterinarians and veterinary paraprofessionals who own and even breed these dogs? They must get it, they must understand, and still at some level, they think it's okay. So in their worldview, it's okay. But here is a very extreme dog. And the top graph on the right there is the increase in registered French bulldogs in the United States. Those are only dogs registered with the AKC, not popular or backyard bred dogs. And the numbers went up. That goes, I think, to 2017 or 2018. In the UK, they think up to 40% of dogs, I think in the UK, certainly registered with the UK Kennel Club, are now brachycephalics. In the lower part of that graph, it shows that these dogs have reduced longevity, and the bottom part of the graph is veterinary care and life statistics from Swedish insurance showing a marked increased risk in French bulldogs for spinal problems compared to the blue line there, which is for all breeds. So there's ample evidence that all these things are occurring, are challenges in these dogs. And somehow the veterinary profession has, in some way, been part of allowing that to happen. I just throw that out for you to think about. So essentially, what makes this such a tough problem is the two basic components: the concern for the welfare of the dogs and what people want, and that's breeders, owners, everybody else. It's further complicated within each category. Concern for individual dog welfare. Right now, the dog may need treatment, may need surgery, and then the breeds and the future. And what we do now will influence what the future is for these dogs. And it's a tough thing to put all that together. Owners want their cute, funny fur babies. They like extremes. Show breeders want a specific type. Commercial breeders presumably are just supplying the demand. And if we could change that, they might supply different dogs. But this combination makes it a tough problem to deal with. So our challenge moving forward is to figure out how we move from this disconnect to what we'd like to see is situations that are good for dogs and good for people. So let's look at a few definitions of health and welfare in dogs and the role of human-animal interactions. Everyone wants healthy dogs with good welfare. At least everyone says just that. But when it comes to making specific definitions, it's very challenging and conflicts arise. So there needs to be clear definitions of dog health and welfare, but these items exist on a spectrum, and it's not always that easy to define them. So in terms of the spectrum, at one end, we can say health is the total absence of disease, but few of us live our whole life absolutely free of any kind of health problems, but we might still consider ourselves relatively healthy. Maybe we should be talking about an absence of preventable disease, or come up with an acceptable level of disease, and then do we focus on rate or risk or both? These are some of the challenges. With welfare, it's quite easy to say an absence of pain and suffering, but again, it's not that absolute, and perhaps we should be talking about an adequate or acceptable level of welfare, and how is that defined? But it's very clear that different people, different stakeholders have different attitudes about what's okay and what's not okay. So additional problems arise when we generalize across different cultures, areas, regions, across disease or breeds, because there's no one size fits all. And I think a lot of the problems nowadays are partly because we try to generalize too closely. So it's not black and white, these definitions, and then we have to consider human-animal interactions. And that's any place where animals come into contact with people, everything people and dogs do together, the human-animal bond. It's how animals enrich our lives and society, etc. And those attitudes and behaviors also impinge on our understanding and acceptance of issues of health and welfare. So when we look at the spectrum of roles and relationships with people, there's a lot of regional, cultural influences on this. And it's not strictly separated by East, West, developing nations. Prevailing sentiment in the US, for example, is quite different than in Europe. But if we look at the spectrum, at one side, we say dogs are sentient beings and they have certain rights. some people might be extreme to one end of the spectrum and say they're equal to humans. At the other end of the spectrum, dogs are property, chattels. The owner decides, perhaps within the limits of actual abuse. So different societies break that down at different levels. But in almost all societies, dogs are commodities. They're bought and sold. And we will talk about that later. So in the spectrum, as I say, in the United States, generally people groups, their needs and desires or their livelihood or business comes above the rights of the animals. Some places in Europe are much more to the other side. So one more spectrum I want to discuss is that leads to the words dominion and stewardship. Somewhere between animals are there for us to do with as we please, or animals are there for us to take care of. And again, it's not black and white. It's not everybody agrees where those differences come. So what we're looking for is some kind of balance between what pets need, what people want, and it's a challenge. Can we achieve a reasonable balance if we understand the spectrum? But as we learned during the pandemic, people want what they want, and everything we taught people about careful consideration before they got a pet went out the window when they were bored and the kids were driving them nuts, and they ran out and got a pandemic puppy. And now we have problems dealing with the numbers, and people are going back to work and struggling to deal with the animals. So it's a challenging situation. Well, let's look at words and actions of veterinarians and how we've been part of the situation. Have we been complicit? Probably most of us at some time have said, yes, well, that's quite normal in this breed. And or we've agreed with someone who said, oh, the breeder told me it was normal for the dog to make noise when it was breathing. That's just normal for the breed. Well, we may have gone along with it, but most of us know it's not normal for a dog. It's typical in the breed. And perhaps we should be a little bit clearer about that. And there have been situations widespread of people not stressing the health issues involved, maybe because there's a long list, not necessarily recording in the record because we don't want to upset the owner by saying what's wrong with the dog, especially when they just come in with a little puppy. And of course, there's a lot of, well, they have the dog and they love the dog and I don't want to upset them. It's a hard situation for a practicing veterinarian. And I'll talk a little bit about this next point in a couple of minutes, but is there a conflict of interest between our concerns for the individual dog, our concerns for the owner, our business side of veterinary medicine, and a conflict between short-term and long-term needs and goals? I'd like to direct you to an excellent resource, which I assume most of you have probably found as it was published last fall, The Health and Welfare of Brachycephalic Flat-Faced Companion Animals, a text that was edited by Rowena Packer and Dan O'Neill, and they both wrote a couple of chapters. It's divided into two parts. The first part is some of the things I've been talking about, as well as research on owners and attitudes, epidemiology. And the second half of the book is on medical and surgical treatment of dogs, but it's really fantastic and needed by vets in practice. Myself and a couple of colleagues wrote a chapter on international aspects. I've mentioned some of it. You can read it to find out more about who's done what, when, where, and what has and hasn't worked and what's being tried. I'll also talk a little bit about the chapter on ethics and the chapter on communication. I wrote a blog called Veterinarians and Brachycephalic Dogs, Ethics and Reality about the textbook. In the text, there's a lot of great information on research done on owners. And again, I think you'll hear about that from Rowena. Owners don't recognize health problems in dogs that are suffering from them. And they acquire these dogs regardless of knowing about health problems and costly veterinary care, and even that they might not live long. In the textbook, chapter 4 is ethical challenges of treating brachycephalic dogs, and it's a very challenging but excellent chapter to read. And they talk about the fact that veterinarians are at risk of a conflict of interest because of the nature of veterinary medicine. They ask veterinarians to think about how they deal with welfare of, for example, brachycephalic dogs, how much of it is impinged upon by the business side. I discussed that there's few balanced directions for the caring veterinary professional in a busy practice. How do you cope with appointments that are too short and too packed to have life-changing discussions with the client? What options are there when up to 50% of practitioners, depending on the country you're in, now work in corporate practices, and they may not have control over decisions about which clients to see or what major efforts can be undertaken. And we're making money as a harsh reality. But there's also a chapter in the book on communication, and it outlines communication strategies that can be used to approach this subject with clients. And I can't cover it today, but I encourage you to read it. But of course, veterinarians in practice today, especially under conditions of the pandemic, are stretched thin. And the challenge of these nuanced conversations is huge. So in a nutshell, we have a lot of clients with compromised dogs who don't want to hear about it. Owners are extremely attached. Veterinarians normalize problems because they don't want to be confrontational and are pressed for time. So that results in a level of cognitive dissonance, which challenges veterinarians. And veterinarians may treat the patient in front of them and just hope that someone else will fix the wider problem. And that may feed into other problems we know are going on in the veterinary world with stress. So more complexity. Other actions being taken, vets in the UK have made up signs about how expensive these dogs are when they get sick. You can look at that more later if you wish. The petitions and the calls for banning, I've written a VIN article and a blog about that these vet bans, vets banning breeds is a very challenging situation and likely to have unintended consequences, even if it can have. The request, the attempt to invoke breed bans is, I think, mainly an emotional response when you don't know what else to do. Not sure vets really want to see all brackies gone or what will come next if brackies go and people still want extreme dogs. All of this is going to require a change in culture. values human behavior and an examining of personal values and what you do about them. This isn't a judgment, but it's just if your behaviors don't fit with your values, you will struggle personally. And that's a concern. So even though we accommodate all these different viewpoints on the spectrum of attitudes and approaches, there's deeper reasons why it can be important to really understand what your personal feelings are about the challenges you're dealing with. And it's the same for breeders. They all say they want health and longevity, but they don't select for it. And I've also talked about the conflicts for veterinarians and having to draw the line somewhere. So I would suggest that you don't help breed compromised dogs and don't do a lot of cesareans on them, but it's a challenging situation. I'm going to make a couple of strong statements here about pedigree dog health and welfare. I don't think the optimal outcomes will be achieved simply by doing a few more health tests before breeding. Many of the biggest problems arise from big picture problems, conformation, lack of longevity, inbreeding, and conditions for which there are no health tests. So health testing is great. Using DNA tests and hip dysplasia x-rays, etc., is very important, but it's not going to be enough to get us out of some of the worst health and welfare challenges that we're facing. It relates to the desire of what people want, and that's a behavioral change that's needed. And we may need to think about outcrossing, and the pedigree world's not really ready for that. The problems of dog health and welfare the worst ones relate to human behaviors and attitudes across all stakeholders. So if we can't change that, if we can't work on human behavior change, our accomplishments will be limited and slow. Dogs are commodities. Yes, they're sentient, but in our world, they're bought and sold. The market and associated problems are driven more by demand and consumers, but we have trouble to deal with consumers or change them, so we focus more on the supply side, for better and for worse. What can you do? Well, change even one viewpoint and start with yourself. Affirm your ethical principles, examine your behavior. As I've said, if there's a disconnect, it may cause you stress, and identifying even small steps that can move in the right direction can be helpful. Not normalizing problems, recording issues in the medical records, talking to clients kindly and compassionately, but honestly about the challenges in their dogs. Don't propagate the problem for the future. Now, this is a tough one when you're dealing right here, right now with problems in practice. But if we're going to make the world a better place for dogs in the future, we have to maybe spay and neuter the dogs that require surgical alterations. Make sure you participate in registries for these surgeries if they're available in your country. Don't assist compromised dogs or sick dogs or dogs with skin infections or atrophy or anything to breed in the first place. And don't engage in multiple elective surgeries for births. And I realize it's challenging to organize that. Talk to your clients, talk to veterinarians and techs that own these dogs, find out why, try to move their viewpoints a little bit. Lead by example, and don't post and share not funny pictures of of dogs are compromised breeds. Don't go along with the idea that it's funny, that they snort or faint or anything like that. And then you may want to lobby your professional association. I'll tell you in Canada that the Canadian Veterinary Medical Association is being very collaborative on this. We have a series of lectures at the CVMA convention and a collaborative presentation with the Canadian Kennel Club. But obviously they need input from people. And lobby the pet industry against the use of these dogs in advertising. This slide is a list of things veterinarians might do to move in an evolution or revolution style from where they're at today. I won't go into it in detail. It's something you need to read about and think about. And so what can you do? Promote healthy breeds and healthy breeding. Try to educate everybody you can and do what you can. It's complex. You won't be able to solve the problem. And when it gets to be too much, grab a cat and take a nap. Thank you very much. I'd be happy to answer questions.
Thank you, Dr. Bonnett. That was a wonderful and very comprehensive presentation. So I'll leave this up a little bit because this gives some information to the folks on the webinar, and I'll let people put their questions in the Q&A box, and we'll kind of tackle those one at a time. I do have a question to start us off on, Brenda, and to give people time to kind of put their questions in as well. So as someone that works at a vet school and teaches veterinary students, what are things that you recommend in terms of adding this to the curriculum? What are things we should be teaching our students above and beyond maybe just some of the health outcomes, but as you said, maybe in communication skills and in dealing with some of these complex issues?
Well, certainly communication skills are needed because these are tough conversations. They often should start when the person walks in with the puppy, but you wish they could start before the people get the puppy. And so communication is huge. Preventing obesity, talks about obesity in these dogs is absolutely huge. I guess the one thing that I think is needed, not just in veterinary school, but across the board, is not to focus just on specific conditions, like just on BOAS or just on appearance or this sort of thing. It is this attitudinal piece. When did we get to the point that we thought it was okay to make dogs with so many challenges, but it was okay because they were cute or funny or whatever? And we have to start with having veterinarians who appreciate these problems and work it for the future, because many people that are in practice today, they're busy seeing all these sick dogs and digging out from under that. Vets in the UK say half their patients are brachycephalic. And how do you dig yourself out from that? How do you make remarkable changes? So it needs an awareness, and it's not all pedigree dogs by any choice. I mean, it's across the board. And I guess people from veterinary clinics could talk to some of these TV vets who promote these dogs and sort of thing, and just get it out there and talk about it.
Great. Yeah, we have a couple of more questions. The first one, as a legislator, if there was one first step change you had the power to make to aid with this issue, what would it be?
That's a really tough one, and so many people have looked for it. I can tell you what some of the legislators have done wrong. Like in the Netherlands, picking on the craniofacial ratio because they thought it could be measured and it would fix everything, and ignoring the complexity of who's breeding and what and all these other factors. That doesn't work well. I sort of think this angle about talking about the passing on to the progeny is an important place to look, because that's where, if you step back and look at the big picture, so it's not just pass the BOAS test and you can breed, it's the breathing, it's the spines, it's the basic structure, it's all these things. Maybe there's some hope to move in that way. But of course, it all comes down to behavior change, and we have to work with the breeders to get them to understand their role or the problems that we see. And I think I would say, I've talked about very negative things, but if we can find a way to be very positive about sound dogs and healthy dogs and promote healthy dogs, maybe that's a positive way we can go. I don't think that was a really good answer to the question, but legislation is kind of hopeless.
There's a bunch of more questions, but there was kind of a follow-up to that. So I wanted to hit on that one first. And that is there any effort to promote or market crossbreeds and create demand that way, as opposed to sort of taking away demand from one, but giving it towards other healthier breeds?
Right. And the problem with the wider crossbreed situation is that many doodles and oodles and these things are produced without good health testing or without any attention to, it's just, I've got two dogs, I'll put them together, it'll be a crossbreed, it'll be healthy. And that's not the way we want to go. I can tell you that in Finland, where they have strong legislation, the Kennel Club is working on crossbreeding programs, and they're very organized and with good goals and very clear steps. And they are moving in that direction because they have to, because of the law, but good for the Finnish Kennel Club. And the breeders, Scandinavians tend to follow rules, so that helps over there. But I see them as potentially leading the way. They say all dog breeds arose from crossbreeding. And who said we should close the stud books forever and ever? And so I think there is possibility of a groundswell of that happening. It just has to not be random. This would just cross two breeds and everything will be fine.
Another question here, are there groups currently actively lobbying to stop using these breeds in commercials?
Yes, there is CRUFFA, CRUFFA. They have a Facebook page organized by Jemima Harrison, who did the Pedigree Dogs Exposed television shows. And they have been at it for a while. In Britain, there's quite strong efforts by the Veterinary Association there. There was meetings with Disney when they came up with their Patrick show. There's been a lot of effort, but I have been a little disappointed by it. There's a dog food company that has a commercial out now. All the pictures are funny dogs, and 3/4 of them are extreme breeds. So that seems to not be sustainable, but I think there is an effort and several groups working in that direction. So a little more lobbying could help. But you understand, these are the most popular dogs. These are the most common dogs. They want to promote them in their, so it's a challenge. There's someone who asked about how effective, do you need effective and clear science communication for behavior change, from Quinn Roche. Hi, Quinn. I think it's as an epidemiologist who taught evidence-based medicine for a long time, we're rational people, and we think if we just show people, if we just give them the evidence, they'll figure it out. I think politically we've seen that doesn't work. And it hasn't achieved what we wanted. So we have to look at behavior change. And most people's behavior is not changed by presentation of more evidence. And if you read some of the research by Rowena and others, with clients and owners of this dog, it becomes clear. As rational, logical thinkers, we think, oh, we'll just pound it into them. It doesn't really work. As someone who's worked in a clinic with both a French Bulldog breeder and a miniature Schnauzer breeder that were clients, the Schnauzer breeder had more C-sections than the Bulldog breeder. Have a hard conversation with these owners and not just hyper-focus on one. Certainly, and it's one of the problems that we have all the time. Years ago, when we were talking about limiting C-sections, people in Norway said, all my clients book elective C-sections because we live far, far away, and they can't wait till there's an emergency because it's a 3-hour drive. And of course, that's a special situation. But it comes back to how much do we believe in the 5 freedoms? How much do we believe that it's important that dogs can breed and whelp on their own? And when is it not being done out of convenience versus when is it not being done because the dogs simply can't do it? So it's a little bit of a decision. And now there's no legislation on it, so it's a decision that has to be made. But I know that out in the world, when I talk to the French Bulldog breeders at the national specialty in the United States, they're like, we all just do it. They can't whelp on their own. The heads are too big and the pelvises are too weird, and that's okay, and we like it that way. And so we have to decide, well, how important is that natural behavior? And it's a role that veterinarians have. The whelping people always say to me, well, anybody with a turkey baster can get a dog pregnant. I'm not quite sure it's that easy. But certainly with multiple cesareans, it's something to think about. Again, no black and white absolute answer. And it's not just French Bulldogs, and it's not just brachycephalic dogs. Agree.
We have a couple more questions. So do you want to go ahead and read them?
Sure. Any thoughts on making breeders licensed helping in any way? Yeah, theoretically, and that's the case in the Netherlands. All breeders are licensed and they can find everybody, both Kennel Club and other breeders, but they're a small country, so they can do that. If you're going to license them, you have to evaluate them. In Sweden, which is a country with 800,000 dogs, they have 125 kennel supervisors or people that visit kennels and look at them. The last time was some years ago when I looked at the AKC, they had 9. So of course, enforcement becomes an issue of what are they being licensed to do, and how does that work? Candace Croney will talk to you about her excellent program out of Purdue, which isn't just about licensing breeders, but it's about a whole health and welfare package of good breeders. And that would work. It's just hard to get that across the board to everybody, but for sure, watch Candace's talk. You'll like it. Should young veterinarians be asking potential employers about their policies around these issues, and how do they stand up to conflicting views? Well, that's a pretty good question, but there's not really an easy answer for that, is that? And I've known excellent young veterinarians who worked with me on welfare issues and gone to work for big corporate practices in the United States, just saying money. And if you can justify it to yourself, it's fine. But I worry about this cognitive dissonance, that if you capitulate on what you believe, eventually it could catch up with you with stress, and you don't enjoy being a veterinarian, and there's a lot of problems out in the world with that. So it's a tough go, but communicating with the practice, starting slow, I guess, trying to make specific changes. Read the, whoever wrote that question, read that page that I had on evolution and revolution and go to the evolution side if you if you're having problems. Approaching breeders on big picture items. Well, I can tell you when I talk to breeders, I had an excellent 2-day seminar on genetic disease with Carrie Eckenstead at the CKC a couple of years ago. And good breeders that are there to get educated, etc. And struggling with inbreeding, for an example. And this is a very deep cultural situation in breeders. They have a lot of habits and they have a lot of traditions that are hard to break free. Some of them see it, but it's very difficult to do it. Read some more of my blogs and things that I've written, because I've written on how challenging the situation is. But even amongst good breeders, there can be denial on what's normal in the dog. So you have to be careful, but you just have to go there and talk about it, because as these things are happening in Europe, as people are calling for breed bans, it's just becoming an ugly world out there, and we need to focus on healthy breeds and good breeders, I guess I would say.
We're just at the top of the hour, but we do have 2 more questions. So if you're willing to answer those, Dr. Bonnett, and then we'll go from there.
Sure. Do you think stronger legislation with increased fines and punishment for breeding these dogs would help with the demand? I'm not sure that's true. That relates to what I said about we like to focus on the supply because we can find the breeders and we can legislate against them, or we could find them, but they're not the ones producing the demand. And as we found in the pandemic, people went out and spent vast sums of money, bought dogs on the internet, bought the unknown people because they just wanted a dog. I think we have to change the public's attitude about what constitutes a healthy dog and what's okay in terms of health and welfare with dogs, if it's really going to make a difference. And this looks like a question for you. Oh, there's Rasa. Hi, Rasa. Working on breeding education website. And I think that's a great thing. I mean, any of the ways we can try and educate people on all sides of the equation is good. We're a little hesitant to say tough things sometimes, but we can try and say them with compassion and try and offer positive ideas of what to do, which I'm terrible at, but I think it's a good idea. So,
one last thought is, do you think emphasizing, this is from Quinn, not from me, but do you think emphasizing benefits of good welfare to the human-animal bond may help?
Well, you've got to read some of these articles about people, and there's some people who feel that some researchers who believe that there's a certain level of almost Munchausen by proxy, that people think they're a good animal parent because they get a really sick dog and a lot of problems, but they're willing to take care of it and do what has to be done. So there is a certain weirdness out there of attitudes of people to these compromised pets. There's a big site on wheelie pugs, and everybody gets together and celebrates that they've all got pugs in these little wheelchair things, and isn't that great? And it's so much fun. I had a woman say her French bulldog had a lot of corneal ulcers, and she said, well, I think that's just because its eyelids don't close over its eyeball. And that, how you say that without total horror, I don't know. But there's a level of acceptance of people about providing care to animals that complicates that situation. And I wanted to tell people, feel free to email me. If you go to my blog, you can find my email. It's just brenda.bonnett, BONNETT, @IPFDogs.com. Happy to direct you to further resources.